Good morning. God's kingdom is at hand. You are not alone. It is well. Dementia. Throughout the years, it's been on the increase. It's in the media, consistently in the media. But now, it's at your doorstep. Dementia is an increasing health problem with different characteristics. People who suffer from dementia lose the ability to perform daily tasks, from the very simple task of cooking food, having a bath, going to the washroom, to all the complex tasks. A dementia patient is unable to perform all these activities. Dementia is a disease in which the person loses their mental ability. It refers to the overall term of different diseases which are related to mental ability loss, communication ability, and unable to do daily tasks. As for Alzheimer's, it is the type of dementia in which the main focus is on language, thinking ability, speaking, walking, which gets worse with the increase in time. As the person ages, the more chance it is they get to have Alzheimer's or dementia, although not always. People who suffer from this disease are mostly above the age of 65. However, young people have also been known to be diagnosed with this disease too. In its early stages, dementia can cause symptoms such as not coping well with changes. One may have a hard time accepting changes in schedule or environment. Subtle changes in short-term memory making is an example. A loved one can remember events of 15 years ago like it was yesterday, but they can't remember what they had for lunch. Now, this is the problem. Your loved one may be reaching for the right words. Word recollection or association may be more difficult at this time. Being repetitive, one may ask the same questions, complete the same task, or tell the same story multiple times. Confused or sense of their direction. Places they once knew very well may now feel foreign. One may also struggle with driving routes you have taken for many years because it no longer looks familiar. Confusion with people, places, and events may no longer feel familiar. One may not remember people you have known for many years or your next door neighbor. Difficulties in completing everyday tasks. One may struggle to recall how to do daily tasks they have done for many years. Just as an example, writing, holding a pen, how to hold a spoon, which to use. A spoon, a fork for different meals may become much more difficult. Confusion with people, places, and events may no longer feel familiar. One may not remember people you have known for many years or your next door neighbor. Difficulties in completing everyday tasks. One may struggle to recall how to do daily tasks they have done for many years. Just as an example, writing, holding a pen, how to hold a spoon, which to use. A spoon, a fork for different meals may become much more difficult. Stages of dementia. One of the most difficult things to hear about dementia is that in most cases, dementia is irreversible and incurable. However, with an early diagnosis and proper care, the progression of some forms of dementia can be managed and slowed down. The cognitive decline that accompanies dementia condition does not happen all at once. That means you're not going to wake up and find that you're in stage 7, for example, and you've started yesterday. That is not going to happen. The progression of dementia can be divided into 7 distinct, identifiable stages. Learning about the stages of dementia can help with identifying signs and symptoms early on. as well as assisting sufferers and caretakers in knowing what to expect in further stages. The earlier dementia is diagnosed, the sooner treatment can start, and that is ever so important. Stage 1, no cognitive decline. Stage 1 of dementia can also be classified as the normal functioning stage. At this stage of dementia development, a patient generally does not exhibit any significant problems with memory or any cognitive impairment. Stages 1 to 3 of dementia progression are generally known as pre-dementia dementia stages. Stage 2, age-associated memory impairment. At this stage features occasional lapse of memory, most frequently seen in forgetting where one has placed an object, for example, forgetting one's name that were once very familiar. And oftentimes, this mild decline in memory is merely normal age-related cognitive decline, but it can also be one of the earlier signs of degenerative dementia. At this stage, signs are still virtually undetectable through clinical testing. Concern for early onset or dementia should arise with respect to the symptoms. Other symptoms. Stage 3, mild cognitive impairment. Clear cognitive problems begin to manifest at stage 3. A few signs of stage 3 dementia include getting lost easily, noticeable poor performance at work, forgetting the names of family members and close friends, difficulty retaining information read in a book or a passage, losing or misplacing important objects, difficulty concentrating. Patients often start to experience mild to moderate anxiety as these symptoms increasingly interfere with their day-to-day lives. Patients who may be at this stage of dementia are encouraged to have a clinical interview with a clinician for proper diagnosis, because there are other symptoms that can relate to something else. So it is vital that you have a proper diagnosis. Stage 4, mild dementia. At this stage, individuals may start to become socially withdrawn and show changes in personality and mood. Denial of symptoms as a defense mechanism is commonly seen in stage 4. Behaviors to look for may include decreased knowledge of current and or recent events, difficulty remembering things that from one's personal history, for example, decreased ability to handle finances, arranging travel plans, and accept those kind of things. Disorientation, difficulty recognizing people's faces and places. In stage 4 of dementia, individuals have no trouble recognizing familiar faces or traveling to familiar locations. However, patients in this stage will often avoid challenging situations in order to hide symptoms or prevent stress or anxiety. For example, I have a client who did have stage 4 dementia, and as we used to go out for coffees prior to this stage, we used to go out for coffees at stage 2. However, when she reached to stage 4, she noticeably found it difficult to go out and sit out and have a cup of coffee in a social environment, because she was very aware of not doing the right things. For example, not using the right cutlery for stirring her coffee, maybe wanting to use a fork, for example, or maybe wanting to use a hair comb to cut her food, thinking that it is a fork, for example. Moderate dementia. Patients in stage 5 need more assistance in order to carry out their daily lives. The main sign for stage 5 dementia is the inability to remember major details, such as the name of a close friend or family member. or at a home address even. Patients may become disorientated about the time and place, have trouble making decisions, or forgetting basic information about themselves, such as a phone number or an address. While moderate dementia can interfere with basic functioning, patients at this stage do not need assistance with basic functions such as using the bathroom or eating. They are still very capable of doing that. However, the use of objects to carry out those activities might become a little disorientated. It's a grey area for them. While moderate dementia can interfere with basic functions, patients at this stage do not need assistance with basic function. Stage 6. In the sixth stage, patients are generally unaware of their surroundings, cannot recall recent events, and have skewed memories of their personal past. Caregivers and loved ones should watch for delusional behavior, obsessive behavior and symptoms, anxiety, aggression and agitation, loss of willpower. Patients may begin to wonder, have difficulty sleeping. I have a client who lives with her daughter, and they have great difficulty sleeping at the moment because the father is walking up and down the stairs at all hours of the morning, even at 3 o'clock in the morning, 4 o'clock in the morning, thinking that they have something important to relay on to the daughter. So this can be a very difficult stage for caregivers. And in some cases, the patient will experience hallucinations as well. My client experiences hallucinations of people looking into her room, identifies people on TV as friends and looking in and speaking to her. There is hallucinations of people opening the closet and wanting to come into her room. There are hallucinations of in the bathroom, people looking in to the bathroom while she is having a shower, for example, or using the restroom, or even in the room, people looking in through the 7. Severe dementia. Along the loss of motor skills, patients will progressively lose the ability to speak during the course of stage 7 dementia. In the final stage, the brain seems to lose its connection with the body. Severe dementia frequently entails the loss of all verbal and speech abilities. Loved ones and caregivers will need to help the individual with walking, eating, and use of the bathroom. By identifying the earlier stages of dementia as they occur, you may be able to seek medical treatment quickly and delay the onset of later stages. Although it can be hard to understand why a person with dementia acts in the way that they do, the explanation is attributable to the disease and the changes it causes in the brain. Familiarize yourself with some of the most common symptoms of dementia and situations that may arise for someone with dementia. If your loved one seems to be having hallucinations, delusions, becoming aggressive, or saying things that are shocking, you can utilize these strategies for responding calmly and effectively. Number 1, aggressive action and speech. For example, statements such as, I don't want to take a shower. I don't want to do that. I don't want to eat that. I want to go home may escalate into aggressive behavior. For those who have asked the best ways to handle aggressive behavior in dementia, as it is not uncommon for a dementia patient to engage in aggressive and sometimes violent actions towards another resident or person taking care of them, it is important to be aware of this type of behavior to mitigate the risk to yourself and others. The Alzheimer's Association states that the most important thing to remember about verbal or physical aggression is that your loved one is not giving you the treatment on purpose. This is not on purpose. They can't help it. Aggression is usually triggered by something, not just a desire to cause you pain. Outside factors such as physical discomfort or pain, being in an unfamiliar environment or situation, or even poor communication can all trigger aggression. It is just out of fear. And don't. The worst thing you can do is engage in an argument or focus the issues that are creating the aggression. Don't try to forcibly restrain the person unless there is absolutely no choice. The biggest way to stop aggressive behavior is to remove the word no from your vocabulary, is to remove the word completely. Number 2, confusion about places or times. For example, statements such as, I want to go home, this isn't my house, when are we leaving, or why are we here? Expressing a desire to go home is one of the most common examples of dementia behavior for those living in a memory care facility. The affected person may have hallucinations or delusions about where he or she is. Remember that Alzheimer's and dementia disease cause progressive damage to cognitive brain functioning, and this is what creates the confusion and memory loss symptoms. When confusion is present, it can create even more anxiety. The combination of the two feelings is hard to manage for the patient. Aggressive actions or speech. Statements such as, I don't want to take a shower, I want to go home, or I don't want to eat that, may escalate into aggressive behavior, as it is not uncommon for a dementia patient to engage in an aggressive and sometimes violent action towards another resident or a person taking care of them. It is important to be aware of these types of behavior and to mitigate the risk of yourself and others. The Alzheimer's Association states that one of the most important things to remember about verbal or physical aggression is that your loved one is not giving you that treatment on purpose. It is not on purpose. It is not directed to you. It is just the way that the brain is functioning. Aggression is usually triggered by something and not just a desire to cause you pain. Outside factors such as physical discomfort or pain, being in an unfamiliar environment or situation, or even poor communication can all trigger aggression. It is just out of fear and nothing more. The key to responding with care to aggression caused by dementia is to try to identify the cause. What is the person feeling to make them behave aggressively? Are they in pain, or is it their mind just wandering? In the brain of a person with dementia, fear and anxiety can feel overwhelming and lead to extreme behavioral symptoms. Once you feel confident the patient isn't putting themselves or anyone else at risk, you can try to shift the focus to something else, speaking in a calm and reassuring manner. According to experts, this is where truly knowing your loved one is so important. The worst thing you can do is to engage in an argument or focus or force the issue that's creating the aggression. Don't try to forcibly restrain the person unless there is an absolutely no choice in that matter. The biggest way to stop aggression or aggressive behavior is to remove the word no. Remove the word no. Number 2, confusion about places and time. Statements such as, I want to go home, this isn't my house, where are we going? Why are we leaving? Why are we here? All of those questions will be put forward to you. Expressing a desire to go home is one of the most common examples of dementia behavior of those living in memory care facilities. The affected person may have hallucinations or delusions about where he or she is. Remember that Alzheimer's and dementia disease cause progressive damage to the cognitive brain functioning, and this is what creates the confusion and memory loss symptoms. When confusion is present, it can create even more anxiety. The combination of the two feelings is hard to manage for the patient. Editor of caregiver.com states that there is also a psychological component to acknowledge. Often people are trying to go back to places where they had more control in their lives. The Alzheimer's Association suggests communicating with simple explanations, along with photos and other tangible reminders to alleviate the patient's confusion. In other cases, it may be better to redirect the person. This measure can be taken if you are in the process of moving your loved one to a facility or other location. You don't want them to wander off, but you can care for their needs with some creative thinking. According to professionals, the best or the better solution is to say as little as possible about the fact that they have all of their belongings packed and instead try to redirect them. Find another activity, go for a walk, get a snack, for example. If they ask specific questions such as, when are we leaving? You might respond with, we can't leave until later because of da 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 da. The traffic is terrible. The forecast is calling for bad weather. It's too late to leave tonight. You have to figure out what's going to make the person feel safest, even if that ends up being a therapeutic lie. Don't. And I mean don't get into lengthy explanations or reasons are not the way to go. But engage in other activities as distractions such as dusting. It's safe, it's good exercise, and hours of mental engagement. Not forgetting the power of music, especially singing to unlock memories and kickstart the grey matter, is an increasingly key feature of dementia care. It seems to reach parts of the damaged brain in ways other forms of communication basically they cannot. Music. Many music students throughout the UK, as well as more experienced musicians, now regard care home visits as part of their learning experience, as well as being enormously beneficial to those with various forms of dementia and their carers. They can also be helpful and rewarding for the musicians themselves. Organizations like Singing for the Brain, Music for Life, Lost Chord, Golden Oldies, and Live Music Now have made it possible for every care home in the country to have access to live musicians, both professional and amateurs, most of them trained to deal with the special need of an elderly, memory impaired audience. Dementia care is daunting, but it may not be as challenging as you would have first expected it. Whether you care for a parent or senior loved one with Alzheimer's disease or another type of dementia, or are a senior care professional approaching your role with some knowledge, the right attitude is always crucial to success. Educating yourself about dementia and maintaining a positive but realistic attitude always allows you to maintain an element of control as a caregiver. If you can take the sting out of surprising challenges you encounter and also improve the care that you provide. Number 1, accept support. Whether you are a caregiver for someone in a family or whether you provide care professionally, never be afraid to ask for help. Ask for help. Many family caregivers find support groups immensely helpful. Support groups allow caregivers to vent into a group setting with people who understand what one another is going through. It also allows caregivers to hear what is working for someone else, another caregiver, and learn about local Alzheimer's and dementia resources. Similarly, professional caregivers shouldn't be reluctant to ask a colleague for support. Number 2, actively empathize. Care starts with compassion and empathy. This holds true in all human relationships, but may be especially salient for dementia caregivers. For example, people with dementia are prone to become confused about their whereabouts and even the time and period in which they are living. For instance, imagine how you felt and would want to be treated if you suddenly found yourself disorientated in an unfamiliar place, or not even sure of the year or even your own identity. Treat people how you would want to be treated. Number 3, be realistic. Be a realistic caregiver. Be realistic about what constitutes success during the progression of the disease. Success is helping to assure that the person you are caring for is as comfortable, happy, and safe as possible. Most experienced dementia caregivers will tell you that the person has their good days and their bad days. Try your best to foster the good days and even the good moments for the person with dementia. Don't try to force them. This will only end badly. It really will. It will just go downhill. You're trying to keep your loved one memory going by forcing them that, no, this is the way this is supposed to be. This is how you put it. I put it here. You took it away. You did this. Don't do any of that. Just don't do any of that. Just be sympathetic to the condition and the situation in which they have found themselves in. Remember that most types of dementia, including Alzheimer's, are irreversible and progressive. Dementia will tend to get worse over time, and there is no known cure as yet. Number 4, dementia is more than memory loss. Memory loss is a classic dementia symptom, but some types of dementia, particularly frontotemporal and dementia and Pitt's disease, manifest themselves as personality changes rather than memory loss. The symptoms depend on the area of the brain that is affected by the disease. Even when the memory loss is the most apparent symptom, the person with dementia is experiencing a neurological decline that can lead to a host of other issues. For example, a prim and proper grandmother may begin to curse like a sailor, or a formerly trusting gentleman may come to believe that his family is plotting against him, or experience other delusional and hallucinations. In the later stages of most types of dementia, patients become unable to attend activities of daily living. Number 5, plan for the future. The only inevitable is change when you are caring for someone with dementia. Never get too used to the status quo. That means that family caregivers should prepare for a time when their loved one may need professional memory care in a residential setting. This involves both financial planning and identifying the most appropriate care options in your area. Professional caregivers and memory care providers also need to plan ahead. They should be mindful to continually reassessing the care needs and health status of clients and residents with dementia. Remember that care need will inevitably increase, and plan ahead for any transition that the residents may require in the future, such as a move to a skilled nursing provider or hospice care. In the UK, there are many care centres. Their goal is to treat people who suffer with dementia and Alzheimer's and help them in living their lives to the fullest. The doctors who diagnose dementia include cognitive impairment because of the aging and depression. The doctors are still trying to find the best cure for this disease. By eating green leaves, green vegetables such as spinach and broccoli twice in a week, a patient's mind would be fresh and can work properly time by time. Nuts and berries are also recommended as the nuts increase the power of the brain and the berries protect the brain and its cells. Nuts are recommended 5 times a week and berries are recommended twice a week. Beans are also known as sharpening the mind and can affect dementia patients positively if they are eaten 3 times a week. Do ask your doctor, your nurse, social worker for more information. It generally saddens me that you have come to this channel seeking help with dementia. It really does sadden me. Dementia to me is a demon disease. It takes on many characteristics. It takes on many forms. I have clients who believe they are children, and even going to the extent of wanting to get into their son's bed at night because they believe that they are children. And I have clients who are just very aggressive, and the family members are finding it extremely difficult to manage their behavior. I have clients whom the family are having difficulties with sleep and whatnot. It's just a really, really terrible disease. The only advice I can possibly give you is take each day as it comes. You never know what's around the corner. If it's a good day, take it as it is, the good day. Appreciate it. And appreciate the little glimpses of your loved one when they do come around. It might be just a couple of seconds, but praise God for those seconds because you had them. This disease, it's hard to look on the good side of it, but the brighter side of the disease is that your loved one is with you and it's not an immediate decline. It's a gradual process. Yes, it's more painful, but you would have your loved one for a much longer time with you. So, peace I leave with you. Peace in your home, peace in your family, peace in all you do, and God bless you. If you like what you've been listening to, do like, subscribe, and share the channel for the growth of the channel so that a whole lot more people will learn to appreciate the elderly and, God willing, treat them a whole lot better. Making a change.